Good evening, everybody, and welcome to tonight's In Conversation event. We're so pleased you could join us, and I extend a warm welcome to all of our staff, students, alumni, and supporters from around the world. For those of you who don't know me, I'm Professor Jane Falkingham. I'm the Dean of the Faculty of Social Sciences, a Professor of Demography and International Social Policy, and also the Acting Vice President for International here at the University of Southampton. It's been a challenging year for all of us, and all of us have faced unprecedented disruption and felt the effects of COVID, either directly or indirectly, in a multitude of ways. A source of great pride for me, however, has been seeing our university community coming together to tackle the pandemic, from staff to students. Members of our city and alumni across the globe have recognised that we have an abundance of talent, ambition and innovation here in Southampton, and our contributions have been making a real difference. From the outset of the pandemic, universities have demonstrated scientific expertise that could generate a solution to the crisis. Academic enterprise has been at the forefront of the coronavirus response, with students and staff providing vital support to communities and academics progressing research that could save and change lives. We have a unique partnership here at the university with the University Hospital at Southampton, and our strengths in medicine, social sciences and engineering in particular are reflecting the truly remarkable capabilities of our university. We've been working on developing vaccines and innovative support technologies, as well as ensuring our vulnerable students are cared for and our hospitals are well staffed. You would have seen some of our activities in the national news. For example, our work on the personal respirator, Persno, which allowed staff to remain in intensive care units for longer periods of time in a safe way. And also on piloting the saliva test, which I'm so proud to have been the academic lead for, along with colleagues at the Faculty of Medicine, in particular, Professor Keith Godfrey. And we've been able to test all of our students on a weekly basis and staff as well. We've also been involved in a number of national clinical trials, including the now very widely publicised Oxford vaccine trial, which we're absolutely delighted about. And our role was the subject of the national press coverage this week. We converted our sports hall into a treatment centre for trial volunteers, and we're really looking forward to the rollout of the vaccine when it gets its approval in the next few days. Of course, alongside all of this, we've been teaching and importantly looking after our students, including offering the opportunity to be tested, as I've mentioned, and as well as delivering our commitment of a high quality education offered in a blended way, we've also been extremely aware of the pressure our students are under and how this could be impacting upon their mental health. We've put in place a number of pastoral support programs to help minimize the feelings of isolation, homesickness and loneliness. And much of the funding raised through the Coronavirus Response Fund has been allocated to helping and supporting our students. And I want to thank all of you who are listening this evening who made such generous donations. Thank you all. We're delighted that Andy is joining us this evening in conversation about pandemic response, data-driven decision-making. I'd like to begin by introducing my co-host for this evening, Francesca Barnes. Francesca is a member of our University Council, which is the university's governing body responsible for guiding the university's strategic plans. Welcome, Francesca. Francesca retired in 2008 from a 27-year career in finance that culminated her at becoming the global head of UBS Private Equity. Francesca now has a wide-ranging portfolio of commercial non-executive positions and not-for-profit roles, including non-executive director of Coutts & Co. and the Coutts Foundation, NatWest and the Harbour Private Equity. And of course, she is a member of our University Council. So we're delighted to have you here, Francesca, this evening. And I'll hand over the floor to you.
Thank you very much, Jane. Absolute pleasure to be here tonight, and welcome to everybody who's joining us. So as a member of the University Council, can I first echo Jane's sense of pride for everything that I've witnessed this year. Universities are so often in the press for the wrong reasons, but when our world is rocked as it has been, everybody goes straight to the experts, to the data scientists, the medical researchers, to the thought leaders. And where are they? They're at the universities. And didn't the university sector rise to the occasion, and particularly Southampton? It's been a real privilege to be part of this community. Our colleagues have worked incredibly hard, but even more importantly, really smartly. And it's a real testament to their dedication and their collective motivation. Our mission statement here at Southampton is to change the world for the better. It's why we exist, and we've really seen it in action in what we've been doing this year. So I'm sure you can tell how proud I am of what the university have done. There are so many reasons, and tonight's speaker is no exception. So I'm delighted to welcome our distinguished guest, Professor Andy Tatum. Andy is Professor of Spatial Demography and Epidemiology at the University of Southampton, and he's also the Director of World POP, leading a group of more than 30 researchers and data scientists. And I'm sure he will tell us about some of the fascinating projects that World POP is involved with. He graduated here in 2001 and has since run international collaborations with national governments and supranational agencies, and he leads multiple research and operational projects funded by some of the best funding, the Gates Foundation, Wellcome Trust, World Bank, Clinton Health Access Initiative, and others. Now, speaking personally as a geographer, and without sparing Andy's blushes, Andy and World POP were two of the main reasons I was drawn to join the Council of Southampton. We are so pleased to have you here tonight, Andy, to talk to us about how the data and the studies and the data that you're studying can help us plan and prepare for COVID-19 and the future threats. So, Andy, assuming that we have perfect communication between us, and I'm looking for you to nod, excellent. Can you start by telling us a bit about the day job before the COVID year? What would you and your team ordinarily be working on, and what is World POP?
Thanks. Yeah. So just to, I guess, justify what we do, I guess everybody will understand there is a need across government, across decision making for population data at small areas. If we want to understand and measure and plan for how much vaccine we need to give out, for where to position a school, for positioning polling booths for elections, for understanding how much money gets allocated to locations. That's all needing accurate and reliable data on populations. And it's something in the UK we often take for granted. So if I share my screen here, so in the UK, we were so taking for granted having data like this. Every single building, this is the centre of Southampton, mapped out. If we go to somewhere like a major city, this is Lubumbashi in the centre of Democratic Republic of Congo, it's a city that's 10 times bigger than Southampton, yet we have pretty much no data. And if we think about the population data, there's the country. It's the size of Western Europe. So each one of those areas is bigger than Scotland or Austria. So there's some population data there. But the last census was in 1984. So we're in a situation where the data is limiting us. What we do in World POP, our normal day job, is to utilize new forms of data to try and improve and complement those more traditional sources from censuses and surveys. So we now have amazing satellite imagery that can map individual buildings. We have mobile phones which are producing data all the time to be able to aggregate anonymously to produce information on where people are and how they move around. And what we do in World POP is layer all of those together as geographers to get information about each location on the planet. So we're a applied research and implementation group. There's about 30 of us, about 2.5 million income per year supporting us. A lot of publications, citations, but the real focus is this open demographic data trying to make things as open as possible, engaging other statistics offices, governments, UN agencies, with a focus on mapping populations, mapping their characteristics, and mapping how people are moving around. And to do this, we build partnerships with data providers like Google, Facebook, Microsoft, for research, for developing those methods with many organizations around the world. And then for implementation, a strong focus of us is trying to go from that blue skies research to actually making a difference to people's lives. And so the data sets, there's now, as of yesterday, 44,000 of those that you can go and download on all things from populations to settlements to urban change, portals for viewing them, tools for interacting with them. And the most exciting part for me is this engaging with the end users. So that's the president of Afghanistan in the top left there. There's engaging with UN agencies in the Pacific, and many countries and governments across Africa. So I will stop sharing there.
That is, I mean, it's quite phenomenal. I've seen it before, but it still blows my mind that your capacity to get across the most extraordinary amounts of data and interpret it and pull out key messages. So what particular areas of WorldPop's work meant that you were able to quickly adapt to focus on COVID? And what did your analysis tell us about the early spread within and beyond China?
Yeah, so the key aspect that I haven't shown in those early slides was that people move a lot. So we're trying to map out where people live, but that changes all the time. And if everybody stayed where they were and didn't mix with other people and move around, we perhaps wouldn't be in the situation we are now. We carry those pathogens with us. And the challenge until recently has been measuring that movement across the globe and within countries, even in small areas. We had censuses which could tell us where people lived a year ago, maybe. We had small household surveys. But what we have now are a range of different data sets. And one of the most rich sources comes from, here's my phone. It's, we're all using phones and leaving digital breadcrumbs around. And there's biases in those data, there's sensitivities, but if treated in the right way and aggregated, anonymized, they have rich data about how populations are distributed and how they're moving. So if I share my screen again and show a short movie of, this is France, and if we're mapping out all of the mobile phone users, we can actually see those changes in density for each day of the week. We see people working in the cities in the weekdays, and then as you go through the week, here we go, Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday, people out in the vineyards, and then back to work. This is unique insights that we've never had before these big data sets. So, and this is the holiday period, everybody going to the coast. So what we had was also an engagement for many years through collaborations with the China CDC and my colleague, Dr. Songji Lai, being able to work with the similar kinds of data in China. So what you're seeing here is the movement in and out of Wuhan. And you see in the top right, the dates, 16th of January, 17th of January, and below that, the outflows and inflows. So the yellow dots are going out of Wuhan, the green dots are coming in. And you see as the dates progress, we're moving towards Chinese New Year. This is the biggest movement of humans on the planet each year. And around the 22nd, 23rd, huge movements out. And then lockdown takes place. And the challenge that the problem we've seen is that that virus had escaped across the rest of China and also across the rest of the world. So if we now, look here, there is, if I can get this working, there is a movie here that, if I can press play, this is a dot for every single flight that's in the air on the planet. So at any one time, there's about 500,000 people in the air, about 6 million people flying every day. even if a tiny fraction of those are infected, we can see how the virus has ended up everywhere across the planet. There are huge amounts of traffic. And so we combined these different data sets, the movement from the phones, looking at where the infections were going within China, with flight ticket data to look at then where were the highest risk areas for movements of infections, and produced estimates of those that went to the European CDC, the Africa CDC, to help them prioritize surveillance. It also went to a lot of media. I think my phone has not recovered from the buzzing and the news stories that came from it. I think it was something like 100,000 views in an hour on a Chinese blog. So a lot of interest in those early stages.
That's absolutely phenomenal. And what we've just seen there is a really good example of this idea of integrating the geospatial, the mobile phone, the health data all together. Given that you can do that, how can that help us design better strategies to control COVID?
So I think what we do a lot in WorldPop is integrating data sets together. And so integrating the mobile data with health data, with geospatial data sets, was what we focused on in the early stages. And this is a disease where so far we don't have a vaccine that is approved and rolled out yet, and we don't have treatments that are very effective. So we're all using these non-pharmaceutical interventions. And so if I go back to sharing my screen again. What we have for non-pharmaceutical interventions is firstly travel restrictions, things that we're all familiar with. There's the early detection and isolation of cases, and then there's contact reduction, so the kind of social distancing measures, all things that we are pretty familiar with nowadays. And what we can do is build a simple model to try and replicate those things. So, and this is a multi-patch model. So each one of these patches could be a local authority in England, it could be a city in China. And you see those orange people are infected, the blue people are recovered, and those black ones are people that are susceptible. The important thing is those movements between those patches. And from that, we can use data from the mobile phones to look at how much movement was there between areas. And so we focused initially on China. And so we could build a model that actually, when we combine together the mobile data with the case data, we could actually replicate pretty well the patterns that we saw. And the value of that is that we could then look and do scenarios. What if we stopped all travel? What if we stopped mixing? And so we could look at, okay, we stop the movements between those patches. We could look at, okay, we take out those people who are infected and stop them mixing with everybody else. Or we stop everybody mixing, we make people stay at home, or we do these kind of 2-meter distance rules that we have in the UK. And the results were in this paper that came out in Nature not long ago for China, that in the period from January to February, if there were none of these interventions, we would have seen around 67 times more cases, a massive outbreak. And in terms of the types of interventions that were most important, was really those early case detection and isolations that were to stand out in terms of the ones that really made an impact. Second place was this inner city contact reduction, so the kind of social distancing measures that are in place. So it really gave us an idea of, firstly, what interventions worked, but then also how they worked in terms of timing. So the dotted line was the actual time that those interventions were put in place. If they were put in place a week earlier, we could have prevented 66% of those cases. 3 weeks early, 95% of them. But equally, if we're too late, those increase in cases can be huge. And this was picked up by the Guardian on the 11th of March as a quite important finding. And then, yes, it was not until June that the that we really had the modeling to look in the UK and say, oh, we probably put in place our lockdown a week or 2 weeks too late. And this is always this is an ongoing situation, obviously, with the second lockdown as well. So I'll stop there.
Thank you. Now, this is just such a perfect example of why it's an extraordinary privilege to be on the University Council, to have an opportunity to work with academics of the extraordinary skill that you're showing to us. And it never fails to amaze me just the potential impact that the university's research has on the global stage. And it doesn't matter which of the charts you've shown us, it's from around the world. So bringing it a little bit closer to home, what can you tell us about what your models are indicating to us about how the situation in Europe?
Sure. I mean, with the situation in Europe at the moment is not great. It's a second wave that I think was not unexpected at all. I mean, talking amongst friends in the summer, it was more about them asking, is there going to be a second wave? Whereas most of us were saying, yes, it's when, not if. And these models can help us think about what kind of strategies can work. And so what we've got in the UK now is, if I go to the next slide, is this kind of tiered system that's coming back into play. And it really lends itself to this whack-a-mole. So I realize that not everybody in the world knows what whack-a-mole is, but it's more of, it comes from the US, and it's a game of hitting a mole when it comes up, and then the next one comes up. And this is, as we're living in a very connected world, this is the situation. As people travel around, they're seeding infections in new places. And so what we were able to do in our analysis was develop one of these multi-patch models for the whole of Europe. We had collaborations with Google and Vodafone ongoing for malaria work, and we're able to quickly adapt those to build a model of how people are moving around Europe and use data to look at how the lockdowns impacted that, which countries locked down first, how much were the movement reductions, and then look at, okay, what happens if everybody did their interventions at the same time? What happens if some didn't? And the results were in this paper in Science, and it's quite a strong effect of message about coordination. If one country doesn't implement effective controls, that second epidemic is much more likely to occur quickly for all the countries in Europe. And it depends on which country as well. Some are much more connected to the rest of Europe than others. So France is incredibly well connected to the rest of Europe. The UK and Germany, we're pretty well connected as well, whereas some others are a bit more isolated and therefore have a lesser impact on the surrounding countries. And how those interventions are put in place also matters. If everybody's not coordinated and putting in place some interventions on one week, not on the other week, nobody's coordinating with each other, we're much less likely to get rid of this virus. And so if we see here, if everybody coordinates, we could actually almost get rid of the virus. But having everyone coordinate across Europe is let alone also within the UK, is a challenge. So that's some of the findings we had from that study.
But that's such a powerful message. It's criminal if that message isn't heard and acted on. And goodness knows what the equivalent pictures would look like of the United States at the moment.
Yes, the US that's something we're looking at, but it's a similar situation to Europe. It's a set of connected regions. Yeah.
Yeah, absolutely, and it absolutely plays the fact that no man is an island, and we all have to take into account each other. So I was going to say, is this data used? And now what I mean by that is, there is so much, there's such a wealth of insight and data that you've got here. Are policymakers actually using the data, and if so, how, in their attempts to do something about the pandemic?
Yes, so we have been collecting as many and trying to get as much use of these data and alert the people that we think should be acting on these kinds of data. So again, if I can share here. So what some of the data sets that we produce, firstly, the mapping of populations across the world, and also the mapping of, and you can go and explore these at the portal in the link at the top, and also the demographics. So this has become pretty important in terms of mapping out where in this case, where the males over 80 years of age, the really high risk groups. And these data have been used in some of the pretty high impact things that have impacted us all. So the model that was used and presented by Donald Trump here uses WorldPop data as its basis. The model that Imperial College produced that sparked the first UK lockdown uses WorldPop data as its basis. We've been working closely with Facebook and the Office for National Statistics, looking at population movements and the trends across the UK for various reasons, and those have fed into Office for National Statistics reports and data sets that go to the SAGE and SPI-M committees that inform government policy. We've also been working with the Cabinet Office on Facebook movement data to look at incoming and outgoing movements from the UK, where at the time they had no data at all that they could get rapidly, for looking at particularly where quarantines came in and out. And you can see on some of these, this plot, you see the massive drop during lockdown, and then rises in some countries like France and Spain, but then drops again as quarantine rules came in. Our data sets have also been widely used by UN agencies in their vulnerability assessments. So this is UNFPA, UN OCHA, the humanitarian agency, using our data sets to map out vulnerability for countries. And perhaps most exciting is working directly with governments across sub-Saharan Africa through this Grid 3 program. This is the Sierra Leone Response Hub, uses population data sets that we made specifically for their response efforts. Similarly in Zambia, mapping out high housing density and high population density and how ease of social distancing can be challenging in some of these areas. And that was used by the governments to think about tailoring strategies in some areas where social distancing is a challenge.
This is all coming out of WorldPop, just WorldPop.
Yes, and collaborators, I guess. Yeah.
So Andy, is there something that we should be doing and are not doing at the moment to prevent the spread of COVID-19?
That's a good question. So, I mean, I think from the messages that you've seen, perhaps me emphasizing, is firstly, we're in this incredibly connected world nowadays. So there has to be some kind of coordination that we, as a UK or US, as many countries are not doing so well. We're seeing the US pull out of funding of the World Health Organization at a time when we really need that. Whereas in a situation where an outbreak on one side of the world can affect us pretty quickly. So coordinating is vital, and also acting decisively and early. It's often presented as a lockdown versus the economy decision, but those countries that have come out of this the best were often the ones that locked down early and decisively, and for a short period, and were able to come out of that quite quickly with limited impacts. So yeah, acting early and coordination are things that we haven't done so well.
Thank you. So, I mean, even before COVID, a lot of your work looked at the spread of infectious diseases, the difficulties of containment and vaccination, and particularly in low and middle income settings. So, possibly impossible question, but I'll ask it nonetheless, if I may. How effective do you think the vaccine program will be to suppress this disease and perhaps even suppress it completely?
I think it's going to be a challenge to suppress it completely, again, because of the connectivity in this world, that we are going to need to get that vaccine everywhere. It's going to be the largest logistical operation the world has ever done to get the vaccine out to in something like for India's target immunity or vaccine strategy, they need to reach 900 million people. Across Africa, it's about 750 million. And if I just share my screen perhaps for one last time here, you can see some of the work that we've been doing with the Gates Foundation and World Health Organization is trying to map out for childhood vaccinations that have existed for decades and that we take for granted. We look at a country in the center of Africa here, Democratic Republic of Congo again. This is the diphtheria, tetanus, and pertussis vaccine that we take for granted. The mapping of the first dose, second dose, and third dose, we can see to get out to the third dose that's needed, a very low percentage of the population actually receives that vaccine. And it's a similar situation with the measles vaccination as well as this DTP vaccination. And it's a similar situation across Ethiopia, across Nigeria. So if we've got a real challenge in getting vaccines out to children, and these vaccines have existed for years. And if we're facing that challenge, the logistics of quickly getting out a COVID vaccine to some of these remote, poor areas is going to be a major challenge. And particularly, we look at things like some of the other work we're doing is mapping travel time to healthcare. So this is mapping to health facilities from a group in Oxford that have produced these by motorized transport, but also by walking. And there are massive gaps across the world in terms of reaching healthcare. So these are things that are going to be a challenge. I mean, it's great, it's fantastic we've developed a vaccine, but it's not really a vaccine that is going to get rid of COVID, it's vaccination. It's getting that vaccine to people. So that's going to be the major challenge we face next.
So the non-pharma interventions are going to carry on being as important as ever?
I think what we're going to need to do is prioritize those high-risk groups, firstly, so that we can return to some kind of normality. But yes, there will be, it won't be completely normal for sure for many more months, I think.
Or perhaps ever, but that's possibly the subject for another conversation. So if I may just turn your thoughts forward, crystal ball gazing, do you think that the governments around the world can use this data to create preventative strategies for the future?
I think these kinds of analysis and data sets can form the basis to guide decision making and base some strategies on evidence. As I said, we're in a very connected world nowadays, but that connectivity is not completely equal. Some areas are much more connected than others, and some time periods are also much more connected than others. And it's data sets like this that can help identify where and when that connectivity is highest and prioritize limited resources that we might have, limited surveillance, to try and stop or identify the next pandemic potential virus that comes along. It's also the impacts of this virus have shown that it's not homogeneous. We're not all at high risk. There are great variations in age structures across the world and across countries. There are great variations in the poor versus rich in terms of how they're impacted. So the more data that we can have to identify those groups, the better in terms of understanding likely impacts.
Well, thanks, Andy. It's just been an amazing evening. Thank you so much for an informative lecture. It's been really fascinating to hear from you. Also, thank you, Francesca, for joining us tonight to co-host. Finally, I'd like to thank all of you out there for joining us tonight and for your interest and support for the university. But in the meantime, just like to say thank you, stay safe, good evening. Take care, everybody. Thank you.